So basically, vitamin E reduces the risk of cardiovascular disease. I tell every patient who have a heart disease or planning on having a heart disease, take a vitamin E. And vitamin E is found in nuts, but unprocessed nuts, unheated nuts. Has to be raw. So if you take them, some people say, oh, I eat mine roasted. I say, well, enjoy it, but it has no vitamin E in it. You can find them in raw seeds, and you find them in raw grains, or a little bit warmed grains and oils. I want to touch a little bit here on allergies. We'll touch about it later. And allergies, it could be anything. And allergies, it could be asthma, could be sinusitis, could be ear problems, nasal congestion, eczema, any symptom in our body that our body is not used to, and that comes out every now and then, every time we eat certain food. So most people do not know what are allergies. Well, allergies is one of two things. It is either acquired, that means you acquired it due to fast food, because you're eating bad diet, because of your lifestyle, because of drugs that you're using or you have used in the past, or due to environment. Did I say you inherited this from your parents? Some people say to me, well, I have this hives. My mother has them too. But both of you eat the same food. You grew up eating the same food your mother told you to eat. And your body is going to develop what she has. That's why you find one family, almost all of them have the same thing. And they say, well, my mother had this, will I have the same problem? Well, the answer is no. Because this is acquired, that means came after birth. Has nothing to do with your genetics, with your weakness or anything. So it could be food, could be lifestyle, could be environment, or drugs. And you address, in this case, in allergies, if you go to a doctor and the doctor doesn't look on your history, pay him, don't pay them, and walk away. Let them chase you out. Because if you don't look at the history, you will not be able to resolve it. The very important factor in allergies is to look at the history of that patient. And then whatever it is, you treat it out. If it's drugs, you remove the drug effect from the patient. If it says food, you remove that food residuals from the body, and that person will be free of allergies. On the other hand, the other aspect of it is inherited. And inherited means there are two ways to diagnose it and to tell what's going on with it. Inherited means you had it at first day after birth. How many of you have allergies? Okay, how many of you are planning on having allergies? Those of you who have allergies, how many of you had it at first day of life? At birth? In the first month? All of you that did not say this allergy showed up in the first day of your life, your allergies are acquired. It is not inherited. So basically you have false allergies. Your body brought something in it and reacted to it, appeared as allergies. It is similar to allergies. This is true allergies. This is false allergies. True allergies, you can diagnose it in two ways. One way is to take some skin test, the skin test that the medical doctor does. This is good test, that's 45% inaccurate. You ask your medical doctor, and it's not specific, which means it is operator dependent. I took the course in Chicago 15 years ago. So what you do, you have an allergen, you inject it under the skin with minute amount. And they wait and look at the results. Well, if I do your hand, when I do your hand here, and then someone else does your other hand on the other side, you may get two different results on the same day. The reason, it's operator dependent. It's also environment dependent. If I change your room and I do the same test, you may see variation. This test is inaccurate. Normally, if a patient walks in with the test, if they say, I have allergies, well, fine. You're welcome. I take that test and I frame it. And I suggest we should do this test. They check 250 different foods from blood. Which, yes?
What about something like these things? I mean, would that be inherited or would it be acquired?
Almost always it is inherited, but I've seen many cases of patients who have had these things, problems, and after we remove yeast from their body, that disappeared too. So basically, it's almost inherited. You do this test. On this test, you may show some problems with honey. Not your honey. And in this case, we take blood from the patient, we send it to Germany. In Germany, they take that blood and make medication from it for you, injection, from your blood, not from your neighbors. And they inject it on a weekly basis. You take 52 injections, and this will be suppressed for 5 years. So you'll have no problems with this allergy, whatever it is, congestion, sinusitis, whatever, for so many years. After so many years, you may still have some problems with it, and we have to be readdressed. The previous one, they acquired, that's it, it's gone. You will not have it again. Now, what are pharmaceutical drugs? The one we use for allergies and the one we use for our heart disease. What they do, they send a message to your body and says, don't do anything, we're here, we'll fix everything. If you take antibiotics send a message to your immune system and says, stop doing anything, we will do everything for you. And then they do not change the toxicity in your cells, which means whatever toxicity we talked about previously will remain at that level. And then it will treat only the symptom. You have a cough today, well, it will take it away, but will not reinforce your body so that this sickness will not come back. Then, any medication you use, there will be a side effect to it. I don't care what it is. And if you look at the CPS book for the pharmaceuticals, you will find that every medication will cause some sicknesses, some other sicknesses. Also, there will be some chemical composition and discomfort so basically, the point I'm trying to take that medication is made, in my opinion, for just today. Unless you are in a life-threatening situation, then we can accept that person use it a little longer. But it is made for today, for you to have time to go reassess the problem and treat it out. Not to be dependent on this medication for the rest of your life. Now some of you say, geez, I am diabetic, what do I do? Well, you know that diabetes could be resolved, and within a year you can be removed from your pill to no pill at all. But the whole idea is patients, I call it patients compliance. If a patient does not comply, does not do what I say, that diabetes, will stay. Excuse me.